want to talk about how some of those sociologic underpinnings are eroding right as we watch them, and that's not necessarily a bad thing. Talk a little bit about the role of the rise of digital technology, which I think Tom actually really covered very well. Very briefly talk about the medical industrial complex response, the incumbents' response, what they should be embracing. And then I'm going to spend a little bit of time at the end as well taking on a little bit of a journey, okay? So I hope you go there with me about what I think the eventual re-evolutionary consequences of the changes that are afoot in healthcare are going to be in the next generation, the generation to follow. Not necessarily in the 3 to 10 year scale, but something we may live to see a great deal of. Now, how do we get here? How do we go from what originally in this country and what persisted for about 200 years is really a cottage industry, a mom and pop shop, a relationship between a provider, a physician, a midwife, a nurse, a frontier medic, and a patient and his or her family, to what we have now, this incredibly large, paternalistic, powerful medical industrial complex. How did we get to this point? And are there any indications that what got us here is changing in real time? So what are the sociological underpinnings of the medical industrial complex? When I was a medical student, I read this book, The Social Transformation of American Medicine by Paul Starr. For some reason, I picked this book up again about a year ago and read it. I could not put it down. Just totally fascinating. The first 2/3 to really understand how we got to where we are and to think about how that's changing in real time. And the last third, actually, the fascinating thing as well, was that a lot of what he predicted was going to happen has happened. Really neat. So what Paul Starr said is, from a relatively weak traditional profession with weak economic significance, we've now become a sprawling system of hospitals, clinics, health plans, insurance companies, and myriad other organizations employing a vast labor force. The history of medicine has been written as an epic of progress, but also a tale of social and economic conflict over the emergence of new hierarchies of power and authority. So what Starr said is that every successful industry from a sociologic perspective, every industry that actually garners customers and holds them tight and benefits from that relationship, does that through some form of the establishment of authority. And healthcare is no different. And the two pillars of authority that Starr talks about are dependence and legitimacy, okay? What I'm going to tell you is that these two pillars are eroding right before our eyes. I think Paul Starr was spot on when he talked about how we got to where we are, and if we're watching closely, how we did that is changing before our eyes. So what about dependence? The concept of dependence means that you have technology that I can't possibly have or use. And so you think about other industries where this is true, right? And of course in healthcare, this has been true for a long time. I mean, who among us can do a CT scan on ourselves and read it, right? There are technologies in people's hands now that they can use that we never would have dreamed of having the ability to use 10 years ago. You think about handheld ultrasound devices, right? They exist now. You can actually do an ultrasound of your gallbladder standing up with a handheld ultrasound device. The problem is you probably can't read it. But the software to read that ultrasound is coming, right? And so in our lifetimes, we're watching the dependence on proprietary technology erode for the first time ever in organized healthcare, in the 100 years of organized healthcare, right now. Never had happened before. And Tom mentioned the quantified self, and so there's actually organizations where people are sharing information about monitoring their own health, wellness, and physiologic parameters. There are organizations like Patients Like Me where patients are sharing it with one another. Patients Like Me was vehemently opposed by physicians when it first was organized. And now, of course, physicians and organizations and the federal government are asking Patients Like Me for data, right? Because patients are sharing data and doing studies in real time that it's really hard for us to reproduce. The pillar of legitimacy suggests that you have proprietary knowledge I can't have, right? And so when I went to medical school, to get the knowledge that I have now, you either had to sit in that classroom or you had to have some way to get into the medical library and understand what the book said, right? I mean, you had to do, that was the only way to get that information when I was in medical school. There was no other way. I was on a panel last year at Forbes Healthcare, and someone asked me about the utility of websites like WebMD, and I was talking about this notion that the twin pillar of authority, legitimacy, was eroding before our eyes. I said, you know, the only difference between the information on WebMD and the information I got when I was in medical school is that the pictures are better on WebMD than the ones I used to look at in pathology during lecture, during class. And so, you know, 100 million hits this year on WebMD. There's content online, just as good as you can get in the textbooks. And as it turns out, it is beyond the comprehension of a large section of the population. Not everybody, and that section's shrinking. And the other thing is that it's amazing, when I was a clinician, how someone with a 4th grade education, when their life's on the line, how well-informed they can become and how good a student they can turn into in a short period of time. And, you know, so it's a little perverse for us to think that people can't understand any of this. So the second twin pillar is eroding as well. So how will the medical industrial complex respond to this erosion of its sociologic underpinnings? So I actually think that the current players are not going to be left out. And I don't think Tom said that, but you know, some people are saying that actually. So this is Bill Gurley. Bill Gurley is one of the managing directors of Benchmark Venture Capital in San Francisco. This was this past January on Twitter. So Bill, and so a couple of things to know about Benchmark. Hugely successful, 250 startups. Many have gone public. And more importantly, he's got 250 million followers on Twitter. Spending time studying where the internet intersects with healthcare. If you have ideas and want to chat, contact me. Okay, that sounds reasonable, I like that. The next one was 100% convinced U.S. healthcare market is really messed up, and that means opportunity, 17% of GDP. And I'm like, this is January of 2014, and you're just not realizing that? But here's the one that really caught my eye. The approach must be orthogonal disruptive, not interested in ideas that partner closely with the current players. And that's where I actually have a problem, because who are the current players? The current players are, whether we like it or not, trillions of dollars of sunk cost, right? They are millions of jobs. They are thousands of spin-off industries, not companies, right? And then the most important thing is there are innumerable relationships. Physician, health system, physician, provider, patient, patient health system. These are real relationships that people have. And so what I say is that the current players are not brick phones, and they're not desktop computers with no internet plugins. And this is what I think the incumbents are going to do. I don't think they're going to be disintermediated. They're not going to go away. If you look at where capital is being deployed, it's being deployed in 3 areas in healthcare. Consolidation of health systems, right? Not disintegration. Risk management competencies for delivery systems, and then new technology. So the first 2 are happening in real time. The problem is that we've got to get the third one linked up with the first 2. Actually, the new technology solutions, the capital that's being deployed, and the current players are actually going to drive part of the change. And why do I think this? I think there are vectors aligned for the delivery systems that have never been aligned before. And the first set of vectors that's most important is the concept of acknowledgement. Literally, for the first time, that there's an acknowledgement, not tacit, but actual, that change has to happen. And I can tell you that sitting in the executive boardroom 10 years ago, we were still talking about, in my delivery system, this will probably pass. And I think the Affordable Care Act was a bellwether event as a healthcare provider. I think this basically signaled to the delivery systems that this is real, not going away. The bill may go away. Who cares what happens politically? The train has left the station. The general public knows it's a problem. The federal government's now focused on it, heaven forbid. And the incumbents know that they have to change. So at least that vector is in place. They also know, I think, really for the first time with real true admittance that they're not very good. 2010, 7 most medically developed countries in the world. This past year, the 11 most medically developed countries in the world. Guess where we placed in year 2010? 7th. Guess where we placed in year 2013? 11th. We've acknowledged that for the first time, I think. This next one's been a little harder to acknowledge, and some of you in the room may not have acknowledged this yet, but I'm going to ask you to go there with me, and that is that there are things that we've done. So we've made 3 big efforts to change the way healthcare is delivered that have been necessary but grossly insufficient. The first was manpower optimization, so more doctors, more boxes. The second has been this concept of process improvement. Good thing, right? I mean, it's great for healthcare to catch up to the rest of the organized world, right? Operating systems are good, as it turns out. And so we've all been leaned or sigma'd or baldridged, over the last decade, and some of us are involved in that right now. Is it necessary? Yes. Is it sufficient to change healthcare? No. No. And health systems are realizing this. Just as soon as we get lean, everything will be better. Well, some things get better. It's still the same delivery model. You're a little bit sick, you go to the small box and see one doctor. You're a lot sick, you go to the big box and see a lot of doctors. The delivery model hasn't changed. This has also been, I think, a little bit of a bitter pill to swallow, that implementing these large data collecting platforms, necessary, expensive, not sufficient. Is this necessary? Absolutely. We have to have the data. It has to be normalized. It has to be standardized. We have to capture all of it to make insights. We need to bill effectively while we're on the road to value, and hopefully it'll be less of an issue in the future, but not sufficient. We're acknowledging that. And lastly, I think it's this issue of manpower, that we're just not going to have enough bodies to throw at clinical problems. So the second set of vectors that's aligning beyond acknowledgement, and I'll say acknowledgement's the most important, of course, is the digital transformation. The internet has changed everything about the way we interact. It's changed everything about the way we get information. It's changed our lives. Moore's law and miniaturization, both miniaturization and modularity of technologies, promises to change things in other ways we can't even imagine, right? This didn't exist 20 years ago. But there are technologies that are changing the way healthcare is delivered in the moment and will continue to drive what I call the big shift over time. And these are technology-enabled solutions that are not directed at diagnosis, that are not directed at treatment, but really directed at changing the methodology, structures, and processes of care delivery. Lots and lots of these technologies. These will change the way care is delivered, unlike those other efforts. The third vector that's aligned, the amount of money that's being directed at these solutions. It is crazy. By 2019, they estimate that it'll be $10 billion a year. $10 billion a year directed at creating tools in this pipeline that we can't even imagine yet. So I think that these 3 things in combination, along with the caveats that health systems are going to have to partner on how to innovate, will mean that the incumbents are actually very involved in this. Healthcare Provider Innovation Survey was performed this last year by AVIA and HIMSS, and just gives you a little flavor of the challenges we're up against as providers in regards to how we're structured to adopt new technologies. The innovation I'm talking about here basically is centered around the thoughtful adoption of new technologies and the changes in your processes and structures that go along with that will change healthcare delivery. That's innovation. 7% of respondents, even though 89% said that innovation is one of the top 3 strategic priorities of the organization, it's actually 71%, I'm sorry. 71% of respondents couldn't pinpoint how innovation contributed to growth of the organization over the last 5 years. So it's a top priority, but nobody really knows how it contributed to growth in the last 5 years. 43% said that funding mechanisms were ad hoc, and so that meant that we'll fund something if it looks interesting, but we don't take any money from the bottom line and apply it to these sorts of activities. There's no other industry that does not reinvest in its pipeline, right? And what we've become confused about in healthcare is that we've equated diagnostic and treatment technologies as being pipeline. The pipeline we should be investing in is technologies that change the way we deliver care. 75% of health systems expect to break even from any innovation investment within 3 years. And that's admirable. The problem is, of course, that a lot of health realized benefits when you change process and structure take more than 3 years to achieve. So what are the re-evolutionary consequences of these new technologies, these new approaches, at the same time that the pillars are eroding of dependence and legitimacy? But I actually think that human beings have evolved with the desire to care for themselves. Over the last 100 years, we have emasculated that desire. And there's some perverse consequences that go along with that. Not only have we emasculated the desire for you to care for yourself, but as a concomitant with that, we've also made you believe that it doesn't matter what you do. You're not responsible, right? If I sit in front of the television, watch football, drink beer, and eat Big Macs, weigh 400 pounds, am hypertensive, and my aorta ruptures, well, you'll fix it, right? Not my responsibility. There's still complex problems that will always require the psychological and/or physiological support of a provider. But there's a lot of stuff, both on the prevention, wellness, and treatment frontier that we could be doing ourselves with new tools. So you think about the combination of this very powerful conduit of information transfer along with these modular technologies combined. There's likely to be monitoring associated with this too, but I don't think it's going to be the scenario where Fred expects you to care for him. I think in the next generation, Fred expects that he's responsible for some of this, or a lot more of it than before. These technologies are coming. And as it turns out, there's a lot of dichotomous things that happen in physicians' offices. A lot of yes-no questions, where the physician is often not even in the loop. Like, for example, the use of painless injection platforms. You know, the question about whether or not to immunize a 3-year-old is not a complex question. Is your child 3? Yes or no? Yes means immunization, right? Do you have a UTI? Yes or no? Do you have a positive strep test? Yes or no? There are a lot of dichotomous decisions that are made, and by dint of information and tools and hopefully responsibility, more and more this will be done by the patients themselves. A central tenet of complexity theory is that in less predictable and more complex environments, hierarchical structures are less and less effective, and hierarchical structures are more and more effective. Of course, what is required for a hierarchical structure to be successful is the perfect exchange of information. This is going to have a big impact, I think, on the structures of the way health systems are administered in the future, less hierarchical and more hierarchical. And then lastly, I think this will be one of the organizing structures for this new type of healthcare delivery where patients are empowered to deliver their own care. More information in real time, more insights shared among themselves and with providers, but not necessarily having providers in the loop. I think a lot about, in this new era of how healthcare will be delivered, some caveats. One of the caveats is that I think we must avoid at all costs inserting technologies between providers and provider organizations and patients in ways that remove us from the suffering of patients. I think a clear understanding of the nature of suffering, both for the diseases we treat and the treatments that we deliver, is key for us to be effective healthcare providers. The thing that I valued most about my time in healthcare as a provider was not my time in the operating room, it wasn't the technical successes, it was the interactions with my patients, but most importantly, it was the thank yous. It was the thank yous, right? And I don't know how many thank yous I got. Let's say it's 50,000, right? I mean, that was fuel for my soul. I don't think I'll ever have any other fuel like that ever. I really don't. But this is what I'm going to tell you. If I had been able, at that point in my life, to know that I could deploy a technology that could have prevented one case of lung cancer because someone engaged with it, changed their behaviors, changed their habits, I would gladly trade all 50,000 thank yous. Thanks very much.